Good afternoon. This is the Thurston County Board of Health. Today is January 14th, 2025. It is 3:45 p.m. Welcome to our first meeting of the year. And so I would like to start off by welcoming one of our new members. Clark Gilman is the City of Olympia representative, and so he's starting his term. Clark, anything you would like to say?
Glad to be here. Got my ears and eyes open to learn.
Well, we're very happy to have you. Okay, so we'll go ahead and start with the approval of the agenda. Is there a motion?
Move to approve the agenda.
Second?
Second.
Okay. So it's been motioned and seconded. Any discussion? Hearing none, I'll call for the vote. All those in favor say aye.
Aye.
Aye. Anyone opposed, say nay. Okay. Next is the approval of the December 10th, 2024 minutes. Is there a motion?
Moved.
Okay. It's been moved by Heidi. Second?
Second.
Seconded by Perla. Okay, any discussion on the minutes? Okay, I'll call for the vote. All those in favor say aye.
Aye.
Anyone opposed? Nay. Okay, and I'll just go ahead before we continue on to just be sure that we do have a quorum. And then we do have board member Lynn Nelson joining us via Zoom. Yep, okay. So with that, we'll move on to our next item of the agenda, which is a proclamation, the National Human Trafficking Prevention Month. We have Dr. Freiheit and I'm going to move this down to tie.
Yes, thank you. Dr. Jen Freiheit, Director of Public Health and Social Services. It is very pertinent that we announce this proclamation for Human Trafficking Month, as there are still concerns in Thurston County. It's still very much a local issue. It's still very much a present issue. And so I would like to invite up Chelsea Keefe to say a few words and introduce yourself and say a few words around this topic. So have a seat right up here if you like.
Okay, thank you for having me. My name is Chelsea Keefe. Thank you for the introduction. I am the statewide coordinating body program manager at Innovations Human Trafficking Collaborative. We're very honored to be here, and we're very honored to have this Human Trafficking Awareness Month, because it makes a big difference and a big impact in our community. Not everyone realizes that trafficking occurs on large and small scales, so it's not always or just a criminal enterprise. It can be something that happens within the context of an intimate partner relationship. And that's something that we see a lot here in Thurston County. So it may start with DV, but then it turns into trafficking. And a lot of our survivors don't understand or are not aware of that fact, or they may not see themselves within the context of being a trafficking survivor. So awareness like this really makes a difference. It allows our survivors to see themselves within that context. It allows them to understand where they are, that they can get help, and that we can offer it at Innovations. So I'm very grateful to be here, and thank you so much for this.
Thank you, Chelsea. Are there any questions or comments from any of our board members?
Yes, I would really like to thank you so much, just with reverence, for being here. I am very passionate around this subject matter as well, and I may have missed it. I don't know, are there any specific data points or a report that we can look to?
I don't have that prepared today, but that's something that I'm sure I could work with our program director to get to at a different time.
Absolutely.
But I know at Innovations currently, we are serving over 100 trafficking survivors within Thurston County, Pierce County, Lewis and Mason counties. So it is quite an issue within our county and within our communities. I don't have those direct numbers for you right now, but I'm sure I could get them for you.
I'm sure
as well, no
Third,
worries.
I think.
7.
There we go.
Okay,
Okay.
there's some statistics.
Okay, thank you. I would like to know from your experience and expertise, do you find, and you talked about intimate partnerships and how things can kind of transpire through that. I'm curious about, again, in just your expertise and experience, how the ports affect this issue for us.
Yeah, I think that would be in a different form of trafficking. I think the ports directly affect our labor trafficking survivors. There was a group of foreign nationals just last year that we were able to help because they were identified at the port. So that is something that's occurring. I would say it may not be the majority of the survivors that we serve, but it is an impactful issue within our community. I think also the interstate that travels from the bottom of the country all the way up to the top is another something else that we have to keep in mind when thinking of trafficking, because trafficking occurs where traffickers are able to get in and out quickly. They often move survivors when they feel that law enforcement or the communities are onto them, that they might start addressing the trafficking. And so an easy way out is something they look for when they're setting up the survivors to work, whether that's sex trafficking or labor trafficking.
Thank you so much, Chelsea.
Thank you. Clark?
Chelsea, first, for the 115 Thurston County people, are those primarily people who are exploited for commercial sex?
Yes, the majority of the survivors that we serve are commercial sex trafficking survivors or sex trafficking survivors within the context of an intimate partnership. We do serve also the labor trafficking side, but there are much less cases.
Thank you. And we've had interest across jurisdictions about a rise in massage
Yes.
parlors with bright neon signs and recent immigrants inside. Does your organization have experience or wisdom as we begin to address that?
Yeah, I think listening to law enforcement is really the key when it comes to massage parlors, because law enforcement has to be able to get in and to address and to rescue those survivors while also convicting the traffickers, which is something that's very hard to do. So listening to law enforcement about what they need to be able to address it is one of the big things. And then also just being aware, raising awareness in the community that this is an issue. There is a national agency called the Network, and they compile data on illicit massage parlors. And I think that they said, when I spoke with them last, there are over 200 operating just in Seattle alone.
Thank you, Chelsea.
Thank you. This is also an issue when I got first, I guess, really involved with it was in my past life when I was working in the immigration field, and I helped so many survivors with the T visa process and learned just why trafficking actually goes from hotel cleaning. I had clients from there to agricultural workers. And I think it's very important as a community to know the signs. And so what are signs that we can give community members to watch out for? For example, it wasn't very recent where someone was telling me, it's like, oh, this building just popped up, and then people were coming in and out of it, and it just looked very suspicious, and didn't know who to call, what resources there were to report something like this. So what are signs that the community members should be aware of? And if there is something suspicious, who in law enforcement should they call?
Yeah, that's a complex question because, as you said, there are so many different forms of trafficking. So the indicators would really look different from case to case. For labor trafficking specifically, illicit massage parlors kind of fall under labor and sex trafficking depending on what they're forcing their survivors to do. So it's a hard question to answer I would say on the labor trafficking side or specific to illicit massage parlors, those that are popping up, that are moving quickly, that have staff that seem to live there, that are afraid to speak to you, that maybe don't speak any English, that in and of itself is not an indicator, but paired with things like control, like living with your employer, like your employer holding your important documents, that would be an indicator of labor trafficking. For sex trafficking, I mean, you shouldn't go to a massage parlor and be offered any form of sex. So that is a huge indicator. But other things for sex trafficking specifically is that it can be sex in exchange for anything. It doesn't have to be ongoing. It can be a one-time incident, but it can be for drugs. It can be for a place to sleep that night, for food, for anything that that person is needing. So those are kind of a brief overview of indicators. If anyone is interested, I can get you a much more detailed list.
I think that would be great.
Yeah,
Thank you so much. Okay.
I have a question. How do you obtain your clientele? Like, do they get referred to you from the police department or from another agency or?
Yeah, we have referrals from the police department, from other agencies. We have a helpline which anyone can call into, do an intake, do a screener, and access our services. We also have an online option on our website where if someone isn't in a space to make a phone call, they can access our services through that online submission, which will come directly to us, and then we'll assign a caseworker to reach out and make sure that they have what they need.
Awesome. Okay. Thank you, Chelsea. So we'll go ahead and read the proclamation. We'll start over on the side.
Okay, sure. Thurston County Proclamation, National Human Trafficking Prevention Month. Whereas human trafficking is a public health issue and a crime that exploits the most vulnerable among us and weakens the health and well-being of individuals, families, and communities across generations. And
Whereas more than 20 years since the passing of the Trafficking Victims Protection Act, human trafficking still exists, including the forced or fraudulent recruitment, harboring, or transportation of people for labor or commercial sex. And
whereas an estimated 27.6 million people are subjected to human trafficking globally, including cases of human trafficking reported in every U.S. state and territory. And
whereas between 2007 and 2023, the Washington Human Trafficking Hotline has received 6,712 calls, identifying 2,320 cases of human trafficking and 4,160 victims in Washington state. And
whereas human trafficking can happen to anyone, people can be trafficked in person and online, in industries such as restaurants, domestic work, construction, agriculture, and factories, and by strangers or someone they know, including employers, partners, and family members. And
whereas human trafficking can be prevented by building individual, community, and societal and understanding and resilience, reducing social inequities and addressing the conditions that contribute to exploitation. And
whereas Thurston County is dedicated to ensuring anyone impacted by human trafficking can receive services that provide individualized care, understand the impact of trauma, and incorporate cultural and linguistic needs. And
now therefore be it resolved that the Thurston County Board of Health hereby proclaims January as Human Trafficking Prevention Month in Thurston County, reaffirming our commitment to increase awareness and education on human trafficking, make resources available to assist individuals and communities impacted by human trafficking, and build diverse partnerships to support a more comprehensive response to prevent and respond to human trafficking. Adopted this 14th day of January, 2025.
awesome, thank you. Okay, so we'll go ahead and do a photo. I know that there's other guests who have joined us here today. So
okay, yes.
stairs.
yeah.
Oh.
Thank you. Okay, and Commissioner Fournier has also joined us via Zoom as well. Okay. Next, first of all, thank you so much for that proclamation and for the guest who joined us today. It's so important, really. Our next proclamation is Birth Defects Awareness Month. And we have a guest, Bonnie Peterson, with children with special health care needs. And so.
Thanks, Jennifer. Hi,
Hi, Bonnie.
I know a lot of you folks, but some of you don't know me. I'm a public health nurse. I've been here for 45 years, just celebrated my 45th anniversary. So I've worked with a lot. Yeah. And that whole time I've worked with children with special health care needs on top of all these other duties. But thank you so much for having me present this on birth defects. Birth defects, they come in many different ways. It's a syndrome, inborn syndrome, or a disease or a disorder or malformation occurs before birth. And it can affect a lot of the internal organs or extremities or just the brain, mental health piece. And it can affect the development ongoing through the whole life of the child. And it occurs usually during the first 3 months of pregnancy, but it can develop anytime during the pregnancy. And so, that's where we have screenings to do for our women. That's why we really want prenatal care, because they do ultrasounds and they do blood tests during the pregnancy, and they do it a couple times of blood testing just to see, and if there is a concern, then they go further and do diagnostics and do more tests. But there's about 1 out of every 33 babies have a birth defect in the United States. That's about 20% of babies. So we have 2 different organizations in the state. One is called the Washington State Birth Defect Surveillance System, where they collect data. So the hospital sends data if they see a birth defect when the baby is born in the hospital. And then there's another, we have a great, robust newborn screening program, and we're one of the better of the ones in the United States. We do over 30 testings. It's kind of a blotter test where they take the blood of the newborn, and then they like to redo it again a few weeks later when they see the doctor, and they redo it again. And then it's about 1 out of every 480 newborns that they pick up a rare syndrome. And there's and that just depends upon some of them. They can do something about these rare syndromes, or else they can at least then prepare the family of what's going to happen. So they're pretty severe things that they're checking for. Okay, so causes, about 70% of the birth defects, we don't know what causes them. But then the other part of them, we know that environmental pollutants and chemicals, and we look at hazards that they are around, exposure to, well, even violence. It can alter their genes. And we know that people that have lead exposure can cause birth defects, medication, infections, and of course our drugs, our illegal drugs that can cause these problems. That can mutate the genes, or it can leave off some chromosomes, missing chromosomes, or break the chromosomes that affect these babies. And we've known since 1973 that alcohol is one of the biggest contributors to birth defects, and yet we haven't gotten that far into really looking at prevention. Is that if they didn't consume any alcohol, they would not have that. And sometimes it's not even blatant on alcohol. They look normal, but then their brain is affected. So it's a spectrum. They call it fetal alcohol spectrum disorder. But we look at now cocaine and heroin, inhalants, cannabis is even now they're coming out with research on that. that they're showing kids, that kids are having more difficulty with controlling their behavior and thinking process, impulse control and all that. And then, of course, our regular prescription medications, there's warnings, you'll see it, or you'll hear it on TV, do not take while you're pregnant. So there's medications that alter that and can cause birth defects. So, and there's a whole list of them, so I'm not gonna get into that. But, and one of the main concerns is what we talked about, is just that trying to get women into access to care, and the earlier the better. There is things that pre-existing healthcare, chronic illnesses that can increase your risk of birth defects, like diabetes, which is now on the uprise. And we look at hypertension, and we look at thyroid disease, kidney, liver. There's some women that get this hyperemesis where they just vomit all the time, which then can cause them to get dehydrated and also can cause issues. So poor nutrition, and then infections. We look at this, that there's a lot of our vaccines that we've had for years now would prevent childhood diseases, but it also, these diseases, if you're pregnant, can cause birth defects. There's quite a few of them that do. And now they're even collecting data on COVID, women that were pregnant and stuff, and what that did to babies. And also, just if you have a fever for over a length of time, or if you elevate your temperature for a long length of time, like they avoid, the thing says don't go into a hot tub if you're pregnant. So those can cause issues too. So if we have, now we have a baby that's born that has a congenital defect, we have doctors that are very knowledgeable in our community. We also have specialists that we usually send out to either in Tacoma or Seattle, and they're followed up by these specialists. There's also, we have Parent to Parent who does the Birth to 3 program for these kids that have developmental delays and need that support. There's my program, Children and Youth with Special Healthcare Needs, that they can call me, and so I can talk to the family and give them extra support or information. The Nurse Family Partnership Program that we have at the Health Department is great because they do a lot of surveillance on these women that are pregnant and a lot of education. And they'll catch things like the other day, we just had a case conference where the gal went into just a really bad high blood pressure, and she just started complaining. She goes, "You go right now." And yep, she needed to go, and she ended up having a preemie baby, but that saved her life. So we have that and many other resources like our WIC program, food bank, all this supports our women during pregnancy when they need it. And so some of the families will say, yeah, I go to Facebook, there's a Facebook page, because some of these diseases are so rare. And so they'll be talking to people that are in Europe and, or down in Saudi Arabia and stuff, and they get connected with these families. So Facebook is, there's a good reason for that to happen, but we have some state and national support groups too. So I guess that's about it. They wanted me to just do 3 minutes, so I'm done.
Thank you so much, Bonnie. Any questions or comments?
I'd just like to thank you for your 45 years. I haven't been here for 45 of them, but I've been here for a lot of them, and you're a really great resource and really support our families.
Thank you, Beth. Thank you. I really appreciate you too. I appreciate your group.
Thanks.
I want to echo that, Bonnie. This is Lynn Nelson at ESD 113. I'm on the Zoom. Hi. And just school nurses and school health professionals in general rely on you to such a great extent, and I'm just so grateful to have you in our community.
Oh, thank you, Lynn.
And social service providers from all over the place depend on you like crazy.
I know, I've contacted you, I don't know how many times. I need help.
And back up.
Yeah, I'm glad you're on this team here. So yeah, that's the importance, is that networking, community networking is so important. The more you acknowledge that other people in the community can do a little piece with the family, and that we all are working for the same goal. And so, yeah, I really appreciate that. All right, thank you.
Thank you. That's awesome, Bonnie. Okay, we'll start with the proclamation on this side.
Thurston County Proclamation, National Birth Defects Awareness Month. Whereas National Birth Defects Awareness Month is observed each January to raise public awareness about the importance of prenatal health, the prevention of birth defects, and the need for continued research and support for affected families. And
Whereas every year, thousands of children are born with birth defects, which can affect their health, development, and quality of life, with birth defects being the leading cause of infant mortality and lifelong disabilities in the United States. And
Are we going that way?
No, I mean, that's fine.
Okay, so just make sure. Whereas the recognition, prevention, and early diagnosis of birth defects can improve outcomes and enhance the lives of those affected, and
Whereas public education and community involvement are essential in promoting the health and well-being of mothers, fathers, and children, and in supporting families who are living with the challenges of birth defects. And
Whereas we honor the resilience of individuals and families affected by birth defects and recognize the efforts of advocates, medical professionals, and organizations working tirelessly to improve the lives of those impacted. And
Whereas this month encourages families, healthcare providers, educators, and communities to work together to share information about prevention, early intervention, and the resources available for children with birth defects. And
Now therefore, be it resolved, the Thurston County Board of Health hereby proclaims January as National Birth Defects Awareness Month in Thurston County, urging all residents to learn more about birth defects, support efforts to prevent them, and contribute to efforts to improve care and quality of life for those who are affected. Adopted this 14th day of January, 2025.
thank you.
Yeah.
Yay. Okay, and so we will head out and take another picture, so.
Yeah.
Wonderful.
good.
Using your chair, is that all right?
yeah, that's right. Taking Wayne's spot.
Really comfortable.
Long days,
Happens
long
right
days.
It's broken in.
I warmed that seat up for you earlier today.
I'm liking yours, Wayne.
Okay, our next item on our agenda is an opportunity for the public to address the board. And so we will, if you'll please state your name and address for the records, and you have 4 minutes. And do we have anyone from the public here to make public comment? Anyone via Zoom? Okay, not seeing anyone in person, not seeing anyone via Zoom either, raising their hand. Okay, awesome. That will lead us to our next item on our agenda, a department item, which is the sanitary code for Thurston County, article revision, and Season Long, our environmental health division director.
And this begins on page 9 of your packet.
And then as a reminder also, this is a follow-up on a briefing that we had in December. So,
Wonderful. Good afternoon, Susan Long, Environmental Health Division Director, Public Health and Social Services. So before I get started, I just want to clarify the action item. We are not looking for your approval today for Article 4. This is just a high-level review and introduction to some of the revisions that we've made, timelines, and for the approval. So I do want to give the board an update on what we've done since the last Board of Health meeting. So on December 17th, we hosted our septic summit with our septic professionals, where we gave a high-level overview of some of our proposed changes to Article 4. Today we posted, which is super exciting, Article 4 on our website, and it is now available for public comment, and there's a form attached to the website so people can go ahead and do that at their leisure. We also emailed our septic professionals a link to the website, so now they know that it's ready for review, and they can also provide public comment at this time. As we receive public comment, we will be updating the code using track changes, so it should be pretty clear what's been changed moving now forward.
Thank you.
So we do encourage you and the public to go to the website to look for the most up-to-date version moving forward, but of course there is a version in your packet for you to review today. Let's see. Out here. Oh yes, and so we will, so like I said, the draft code's posted on our website, and we will be pushing this out through the PHS social media platforms. In addition, we'll be hosting a septic professional meeting at the end of this month to discuss Washington Administrative Code updates. So that's the state WAC revisions that was adopted in January 1st of 2024 with an effective date of April 1st, 2025. And we'll also, of course, discuss Article 4 changes as well at that meeting. For the March Board of Health meeting, we'll schedule a public hearing to adopt the code with an effective date of April 1st to meet state requirements. So that's kind of what we've done and the path forward. Does anyone have any questions about the timeline?
How long will the public comment be open?
So it's open now, and then the date of the hearing, it would be closed at that point, so.
any additional questions? Summer, can you please state the website just for the public?
I'm actually going to post it in the meeting minutes because it's very long.
It's very long.
Yes, so it'll be available after this meeting.
So it's just in
on
the
our Facebook and other channels as well.
Perfect, so it's just through the general public health website and then go into the environmental health section, I'm guessing.
Yes, exactly.
That area.
Exactly.
Okay.
I know, I do have additional, I just wanted to make sure you're good with timeline, but I do have some additional information to share with the board when you're ready.
Perfect. Any other questions on timeline?
Okay, thanks. So I just want, like Jen had mentioned, we have a lot of information in this packet. I know it was pretty thick. So I just wanted to review the packet and let you know where certain information can be found. So like Jen said, from pages 9 to 19 is the summary of Article 4 changes, which we'll be going over today briefly. Pages 124 to 177 is the clean copy of Article 4 for your review. But again, it can also be found on the website moving forward. And then in the PDF agenda packet, there's the hyperlink to the strike-through changes. We didn't print it out because it's pretty lofty. And with the strike-through changes, it's kind of difficult to read, but it is available for your review if you would like to look at it. So, and then I would like to go through some of the summary of Article 4 changes, which is pages 9 through 19, some highlights.
Susan, if I could ask before you jump in, just for the changes.
So the state code was updated, and now we have to make sure that our code is as strict or stricter than the state changes. So that's where the timeline came from. So they got effective date of January 1st is when they adopted it. Effective date is April 1st, which we also have to meet in order to meet the state requirements. So, yeah.
The team has known that this has been coming and has been working on these all year.
Yes.
It's been a very intensive project.
Yeah, since March, so.
Sounds like a labor of love.
Yes, definitely so, definitely so. So again, I just want to go over just a few highlights from the summary sheet, which looks like this. Let's just start on page 9. So the first one I want to draw your attention to is item number 19. And this has to do with surface water. So the current code is written where there's a 100-foot setback from individual wells, springs, or surface water that is not a public water source. The change we're recommending is that we include all surface water. So lakes, streams, knowing that our waters are an important resource and we want to protect them. So that's one of the updates we're proposing. If you look at pages 11 through 12, items number 21 through 29, it's our design requirements. This is more technical in nature. This is really for our professionals. A lot of these requirements are already applicable and applied through our policies. We just put them out of our policies into the code, so it's more transparent to the designers and the public of what our expectations are when folks are designing their systems. The next item I'd like to draw your attention to is on page 13, item number 36. So the way the current code is written now, an initial operations and maintenance inspection needs to be performed by a licensed professional for the first inspection, and then at least once within 9 years. This is very specific to operational certificates that are renewed every year. We would like to make this a countywide requirement. So a system's installed, the first inspection that it receives is from a professional, and then the homeowner could take the class and become certified and do their own inspections. But on that 9th year, we would like to see a professional look at that system again, just to make sure that it's still operating as intended. So that is the proposed change that we're making.
Can I ask a question on that item?
Absolutely.
Is the reason for that just to get more of those certifications countywide in, and so public health can have that information?
It's not just to get them in, but that we have a certified professional who has eyes on the system. The homeowner could take the class and become certified, but there's not necessarily a renewal to that certification. So we just want to make sure within a 10-year span that there's a professional evaluating the system to make sure that it's still operating appropriately. Yes.
So does that only apply to those that are using the class and the self-inspection? Because I thought state law required every 3 years an inspection. I know you can get around that, so to speak, by doing your own inspection, but is the 3-year requirement still there if you're not doing your own inspections?
So for gravity systems, the state code says you have to have an inspection done every 3 years. And if it's a proprietary system or anything that has a pump, it's annually. So and certain systems can only be inspected by professionals. A homeowner can't do them. It's based on the proprietary nature of the products. You have to have a certified professional inspect those systems. So this is really geared toward gravity systems or pressure distribution systems that homeowners can inspect. But we want to have a professional look at that at a certain time interval level, which would be every 9 years.
So, but just to clarify then,
Yeah.
they still have to be looked at every 3 years, either by yourself or by a professional. And if you're using the self system, then you have to go to a professional every 9 years.
Correct.
Okay. So this isn't nothing's been rolled back, so to speak.
No.
At state, this is sort of adding an extra wrinkle for the folks that are doing self-inspection.
A layer of protection
Yeah.
for the environment, yes.
Perfect. Thank you. That's what I'm
Good, thanks. Any other questions on that item? Okay. And then if I could turn your attention to page 14, item number 42. This has to do with inspections of particular establishments. So campgrounds, mobile home parks, RV parks, and adult family home facilities. So they do have typically an OPC, so an annual renewal. But again, we're just taking our policy that says you have to have these inspections done in a certain interval and putting it into code. So it's already a requirement. It's just now a little more transparent for these facilities. And then the last item I'd like to draw to your attention is on page 19, item number 58. And this is adding language that we don't currently have in the code. And the language is monitoring the performance of installers, pumpers, or monitoring specialists or firms throughout a quality assurance program. So this is really giving us the ability to move forward with a comprehensive QA/QC program for our professionals. So that would be our pumpers, our installers, and our certified monitoring specialist.
On that last item,
Yeah.
when you said something that's one place is now going to be brought forward into the code, where is it now reside? The last set of items you were talking about?
Was that not policy?
Policies.
Yeah,
okay.
it's in policy, so we're gonna move it to the code to be a little more transparent.
Susan, thank you for not only providing in the packet the strike-through versions, but also this summary sheet and taking the initiative to do that, to walk us all through a pretty dense topic. What initiated this was the state's action and the county's need to get in compliance and up to speed with the states. Thank you.
I'll be looking forward to your comments. Please contact me if you have questions. Oh,
I'm Clark Gilman. I'm Olympia representative, new as a municipal rep here. So I missed the briefing. And this may just be a parking lot sort of issue, but I'm curious about alternative systems, biological treatment and gray water systems after you've hooked up to sewer, for sewer. Are those covered under the Class A waivers? Is there a specific provision for alternative systems?
hand that over to you, John.
So your question is after they've hooked up to sewer, if they want to retain
A gray water
a
system?
water system? Yeah, we'd have to look into that and I can certainly get back to you.
And the state building code provides both of those as and also biological treatment rather than chemical treatment in the holding tank. And I just didn't know if we had made provision for those or if those would fall under the waiver sort of process to try to permit them.
We'll look into that, get back to
We
you.
can talk about it another time. Yes, thank you.
I'm just upstairs.
Great.
Any additional questions? And so, Susan, you don't require any action from us at that time. If you would like further information, please do send your questions over. This is a very heavy topic that has just a lot of intricacies that go into it and a lot of technicalities that go into it. So, thank you both so much. Melanie, could we move the little? Okay.
Cool. I'm Katie Strozik. I'm the Opioid and Overdose Response Program Manager at Public Health. Today we'll go over kind of some information gathering on how we revised our opioid response plan for the proposed 2025 response plan, what we changed within it from 2024 to the proposed 2025 plan, and then some highlights of our activities that we did in 2024 to show that it's not just a plan that's on paper, it's something that we're out and about doing in the community, that's impacting folks here in Thurston County, that is also saving lives on a daily basis.
You just have to use paper for a minute, so just continue on.
That's okay.
Remember last year we were in the dark? With no power, so Katie brings good luck.
Oh, I was thinking about that today. I was like, it's a treat to have power. So the response plan is tied to the resolution that came out of the Board of Health in 2018, and then the Thurston County Opioid Response Task Force was also convened in 2018 as well. The response plan was formally adopted in 2019, and then it at first was adopted and revised on a 2-year basis, and then the last few years we've been revising it on an annual basis, just because we've seen so many changes at both the local
local and the state level, as far as with overdose rates, drug trends, ways that folks are using drugs, all kinds of things like that. We realized that we really needed to look at community input, aligning with state plans and things like that on a more frequent basis, and that 2 years wasn't cutting it. So we swapped and went up to 1 year. And then it also supports strategic plan initiatives 1, 2, 11, and 12 as well. For our Thurston County Opioid Response Plan, we have work groups that do kind of the boots on the ground work. So we do have the overall larger task force that meets on an every other month basis. And then all of the strategies within the response plan are assigned to an action-oriented work group. We have 4 of those. We've got prevention, treatment, overdose, and pregnant and parenting. Each of those work groups meets on a monthly basis, and they're going to be the ones that set their SMART objectives for each of the strategies. They set the measurable goals, what they want to do, how they're going to do it, when they're going to do it in the year, and then they also take ownership of everything that they're doing. So when we talk about creating an educational material around a certain topic by December, that work group is the one that's bringing forward the topic. They're developing the materials, they're looking at the design, everything like that before it goes for a final review process as well. Between those 4 areas, we have 29 proposed strategies in the proposed 2025 response plan, and you can see they're separated pretty equally with the exception of overdose having a large amount of strategies. That mostly is due to that aligning with a lot of the work that we already do through our state Department of Health and Healthcare Authority contracts. So we build those into the plan as well to make sure that the work that we're already doing is captured, and a lot of those have to do with overdose just because we do have such high overdose rates in Thurston County. So for our response plan revision for 2025, we went through a community-based process this year. A couple of years ago, we did a really big stakeholder engagement survey where we did almost like focus groups, where we did 1 to 2 hour sessions where we separated it into different topics. Folks from the community could come, share input, and it was really the first way that we were able to gather large-scale community feedback on the plan, priorities, and revision during COVID, so it was all virtual. This year, we knew that we didn't want to do something quite as big. Those were a large project to take on, and it's really hard to get folks engaged on Zoom now for an 1 to 2 hour thing. Unlike a few years ago, folks were a lot more gung-ho to kind of be on Zoom and share things. So we wanted to do it in a little bit more of a bite-sized piece so that we could get more folks engaged, folks who maybe didn't work professionally, touching, treatment, overdose prevention, and things like that, so that just the general community member who is not touched at all in the professional world could still look at the plan, look at what we're doing in Thurston County, and share their feedback on what they think is important, what they think we're missing in the plan, and not have to dedicate 2 hours in the middle of most likely their workday to provide feedback. So we were able to take that idea to the task force, and they really wanted a survey to be done that was electronic and short, that could be taken by anyone, regardless of affiliation or anything like that. So we created an online survey. It had a little bit of demographic that it captured at the beginning, because we didn't want to capture how many folks self-identified with having lived experience with drug use. It was optional for folks to be able to select whether they identify with lived experience or not, but it was there so we could capture some of that data. And then we left it pretty open-ended. So we separated it out into our 4 action-oriented areas, and we're able to gather, what do you want changed? What do you like about this? What do you think we're doing is awful in this? And folks were able to type and submit ideas, questions, comments, and then they also were able to do just general comments at the end. And there was a way for them to stay engaged in the task force and response plan process on an ongoing basis as well. We were able to get 101 total responses from community members, which for an online survey is a huge amount. We had it open for about a month. We kicked it off at our Thurston County Opioid Response Forum in the fall. We blasted it out on just about every email list to providers on Facebook. Our community partners shared it. We had paper flyers that went out. So we got 101 complete responses. So folks who opened it up, filled out the whole thing, and hit submit. A majority of the responses encouraged the work that we were doing. Most folks didn't have any changes that they wanted. A lot of folks said that they really liked what we were doing, that they felt it was all-encompassing, that they really appreciated the work that was being done, and had just overall positive remarks. Some of the remarks that we did get in the comments had an emphasis on wanting to increase education and services specifically for two age populations, both younger adults, so youth, primarily those under 18, as well as a lot of folks pointed out that rightfully so, our plan was missing really a focus on older adults, primarily those age 55 and older or 65 and older. We've missed that as a priority population in our plan the last few years. And so from the response plan revision survey, we were actually able to see that feedback from the community, pull that out, and then add it as a priority population in our proposed 2025 plan as well. There was a lot of comments about wanting to increase utilization of peers across all subject areas. So from prevention programming to overdose response to treatment programs, really wanting to utilize folks with lived experience, current living experience with drug use and mental health in order to provide those services to the community. And then a lot of folks also pointing out that really wanting to emphasize further inclusion of polysubstance use, recognizing that a lot of our folks in the community don't just use one drug, and making sure that the services that we're doing, the education that we're providing acknowledges that and recognizes and is responsive to the fact that folks are often not only using fentanyl or they're not only using meth. It may be more than one drug at one time, or it may just be more than one drug overall. So with that, for our proposed 2025 response plan, a majority of those 29 strategies are going to be carried over from the 2024 response plan. There are some things that are like minor wording changes to update to state and federal guidelines, and then some minor wording changes to make sure that all 29 align together and are consistent. We did add to the priority populations for older adults age 65 and over. We also completely reformatted the response plan this year. So the last few years, it's looked exactly the same as far as like template wise. This year it's revamped because one of the things that we noticed in the community is it was really hard for folks to digest. It's a really long document. And it was separated previously into our 4 action areas, and folks would just wonder where something was and just not really know which action area to look in. So we redid it this time and aligned it instead with the 5 goals that are laid out in the Board of Health resolution from 2018. That way you're able to see how things are broken down in accordance with the goals that started in 2018. And then it's crosswalked as to what action area work group it lives in as well to make it a little bit easier for the public. We also have an increased emphasis on stigma reduction. That's one thing that comes up a lot, is wanting to make sure that we address stigma not only in the types of treatment that are available, so like medications for opioid use disorder, but also stigma as far as our clinical providers who may be providing other care to folks who are also using drugs, or just stigma in our general community to make sure that we are focused on doing fact-based drug education and talking about overdose and how to respond. We also were lucky to be able to expand our strategies related to the pregnant and parenting populations in our plan. In the last year, we were able to dedicate a full-time staff member to working on pregnant and parenting and other priority population work. And so because we have staff capacity now, we really are able to bulk up that part of the plan to give it the attention that it has deserved. And then just some highlights, some things that we did in 2024 to kind of show that it's not just a paper plan, it is something that we're out and about doing in the community. We did have an opioid response forum event in October 2024 at Lacey Community Center. We had a great turnout. We had over 125 people attend from all different sectors, including just community members who don't work in the field. Within the last year, we developed a full spectrum reproductive care guide, which is meant to be a comprehensive resource for different reproductive care options. It's meant to target folks who are in drug using populations, but really it's applicable to anyone in the community as well. It doesn't have anything drug specific in it. We ran a couple countywide safe medication disposal and safe medication storage campaigns, including partnering in our rural communities who may have limited resources in other capacity. We collaborated on a DSHS event called Facing Fentanyl Together. DSHS was tasked with doing that event in each local community from the state level, and most DSHS offices were unable to partner with their local public health departments. We were one of the only ones in the state to partner proactively on the event and co-facilitate the event with DSHS. And then we also ran our Overdose Awareness Day in August, which was a little bit before August 31st. Because of the days that it fall on, but we had a great resource fair and memorial table and everything like that. I do also just want to call out the work that we do around our overdose response and naloxone distribution. So public health, we offer overdose response trainings, how to use naloxone, how to recognize and respond to an overdose. We continue to increase the amount of trainings that we do on a yearly basis. So we did around 110 trainings in 2024, which is an increase from 2023. And I believe that from 2022 to 2023, we had double the amount of trainings. So we're consistently continuing to increase those. As far as naloxone going out into the community too, so we do distribute at those community trainings if they're for a priority population. We distribute at community events, things like that. We gave out over 500 naloxone kits just at those types of events and trainings, and to community partners, so like the business downtown to have a kit if an overdose happens outside of their storefront. We also give out naloxone at our syringe services program, and I really want to highlight that because getting naloxone into the hands of people who are actively using drugs saves the most lives. Drug users save the most lives in our community, above law enforcement, above EMS, above everyone else, and it's really important that we give them access to naloxone and the amount of naloxone that they need. So just at our syringe services program, in the year 2024, we gave out over 3,225 naloxone kits, both nasal and intramuscular injection. And one of the great things about our syringe services program is we also collect a little bit of data to report back to the state when we give out naloxone as well. We ask folks if since the last time they got a naloxone kit, if they responded to an overdose, and gather a little bit more from there. So essentially we're asking folks to self-report whether they had a successful overdose reversal when we're replacing the kit. And just for self-reported overdose reversals at this one program for our syringe services program, we had 427 reported overdose reversals in 2024. So that just shows that those are 427 non-fatal overdose that we were able to have because of our naloxone distribution. And then, as always, the little picture with all the naloxone stuff. We do have a person with lived experience in our community who we partnered with to do art a few years ago. We have a great campaign that is supposed to decrease stigma around naloxone, normalize talking about it. It's more of a first aid response. So we do have the stickers, buttons, magnets, and things like that. So if you see them out in the community, they come from our program.
Thank you. And the whole opioid response plan starts on page 188 if you would like to review that. Thank you. Are there any questions or comments? And I just want to say we do have a time crunch over here. It is 4:44. So saw Dr. Harvey and then on deck, Rachel.
I have a very quick question. So I was talking to one of my patients about the fentanyl test strips, and then you tried to figure out where to order them, and I guess Amazon won't deliver to Washington, and so we weren't like, do you know where to get fentanyl test strips?
Yeah, so Amazon is supposed to. Department of Health also doesn't know why it's blocking it because they're legal in our state to get to. So if it's somebody just looking to access test strips in the community, our syringe service program has them. They're always welcome to access them there. There's another few community partners who have them. You, in theory, should be able to get them on Amazon, but you also can get them from a spot called Dance Safe. They sell them directly as well. I can provide the links too for where to purchase them. We do have them for free though in the community, so if it's just someone who's looking to get like a chunk of them, get them to them.
Yeah, I just want to comment, it's just a comment, but I want to recognize the work that you've done, Katie. I attended nearly every one of these events last year. I also I am a person of lived experience, and I'm very involved in, I was working for King County, and I just want to recognize that even in King County last year, your name was recognized as one of the leaders in our state and in our nation, and I want to make sure that we're recognizing the incredible amount of work that you've put into really bringing this to the forefront in Thurston County, and so thank you for that, and your work has just been absolutely incredible. I will recognize that last night, one of my closest high school friends, I'm 49 years old, died last night due to opioids. It is something that we have to keep at the forefront and continue to work on, and I love this idea of older adults. It is hitting us all, so just thank you so much. You've been great.
Katie has been great, and not only just for her, she's engaged so much with all of our local jurisdictions, with all of the different community partners, and that is so important. And all of those events that you held, I was able to attend some of them, and they were just great events for the community. So really great job and really getting the word out there. Okay, I'm not seeing anything else. There is an action to approve the opioid response plan. So I am ready to hear a motion if there is one.
Approve the 2025 opioid response plan.
Second.
Okay, it's been moved and seconded. Any discussion? Seeing none, I'll call for the vote. All those in favor say aye.
Aye.
Okay.
Aye.
Was that a nay? Okay, thank you. Okay, moving on to our next couple of items. The next two are connected, so we'll start with the first one, which is the administrative officer, RCW 70.05.045 appointment. Previous Board of Health members, you might remember that this was something that we've been working with the state for a while now, so I'll pass it on to Dr. Margaret.
Thank you. I'll make these next two quick. They're more housekeeping sort of issues. In the past, the Board of Health has then submitted to the Board of County Commissioners to, just as you have the nomination for the chair and the vice chair, an administrative officer. In our bylaws, the administrative officer is the director of Public Health and Social Services. However, in the past, it was always named as a name. So it was Shelley Slaughter, Kurt Hart, and David Bain's name is still on it. My proposal that I would like for review and approval is to basically put in, while we're doing the chair and vice chair for the Board of Health, is to dename the administrative officer and basically just state the director that is amenable to you. So just really quickly, the administrative officer, RCW 70.05.045, the administrative officer shall act as executive secretary and administrative officer for the local Board of Health and shall be responsible for administering the operations of the board, including such other administrative duties required by the local health board, except for duties assigned to the health officer as enumerated in RCW 70.05.070. So this would basically be approval by you all so that I could add that when we do chair and vice chair and take it forward to the Board of County Commissioners.
Thank you. Okay, any questions? Okay, is there a motion to approve? Don't be shy, everyone today. It's like no one wants to make motions. Okay, there is a motion. Is there a second?
I'll second it.
Okay, it's been moved and seconded to approve the administrative officer appointment. And so, any discussion?
In the generic form is just director, so we're not changing it every time.
Okay, so hearing no discussion, I'll call for the vote. All those in favor say aye.
Aye.
Aye. Anyone opposed, say nay. Okay, approved.
Great. Next one is just, again, a little bit of housekeeping. We have a regional medical officer named Dr. Tin for however many counties down here in this region. And if there is ever a situation where our current health officer had a sudden illness or, and I'm sorry, I'm on page 201, had a sudden illness or a family emergency and needed to go out, at that time we would establish an MOU with the state for the regional medical officer to help oversee for our county. I would like to be proactive in developing this MOU now, also making it a little bit generic, not necessarily putting Dr. Tin's name in there, but stating whoever the regional medical officer is at the time. I'm asking for your review and approval. On page 201, it is the guidelines by the state for which to do this. I will point out just the last two bullets of those 4 bullets in the middle of the page. They would just like to ensure that the local Board of Health or other authority appoints the regional medical officer in that situation. It's not something we have to appoint right now. And then also ensuring liability coverage. So the second page, or the page 202, 203, and 204 are the actual agreements. So my request would be, may I carry forward with legal ensuring liability, that all the legal measures are taken care of, have this signed preemptively, just in case anything ever happens, so we can move smoothly should something ever occur in that form. And I had nothing necessarily to point out on the agreement, it's pretty standard.
Any questions?
I do have a question. I'm just curious, can you give me an example of what, is this just like a major crisis and like you're completely indisposed and this is affecting multiple counties at a time and then this person would essentially step in to give us guidance or? Like, I'm just wondering like.
Not quite, but let me explain. So right now, for example, as our health officer is down to 0.6 time, and is still on call on the weekend and could flex that time during the week, but, let's say out of the country, not available, right?
Okay.
We can pull upon our regional medical officer without an MOU right now for any backup situation. This would be for if our current health officer, because every department has to be covered by a health officer at all times, if, you know, had to go out for a family emergency for a couple of weeks, or it could be prolonged longer, as it talks about in the first paragraph there on the guidelines, that we could seamlessly get someone else in to help make decisions, cover cases, all of that sort of thing. So it's just a proactive measure in case we needed to switch to that model for a temporary stay. Thank you. The health officers all together, though, if there's a big emergency, work together all the time anyway.
Right.
In the state, yeah.
Thank you. Any additional questions? Okay, is there, oh, you have a question?
No.
Oh, you would like to make a motion? Yes, please, go ahead.
I would move to approve the interlocal agreement for acting health officer coverage.
Second.
Okay, it's been moved and seconded. Any discussion? Hearing none, I'll call for the vote. All those in favor, say aye. Aye. Anyone opposed, say nay. Okay, approved. Next is the health officer and department director reports. There is the report that was submitted. Does anyone have any questions on the health officer or the department director report? Okay, I'm hearing none. So we'll go ahead and move on to the next item, which is the chair and vice chair elections. And so we'll go ahead and start with the chair position. And so if you would like to nominate someone or nominate yourself, this is your opportunity. So are there any nominations for chair?
Yes, I would like to nominate myself for chair.
Okay, and I will second that nomination. Are there any other nominations?
I would like to nominate Commissioner Grant for vice chair.
We're doing chair nominations right now.
Oh, okay. I just showed my cards.
Okay, one more time, chair nominations.
I'd like to be considered.
Okay, Dr. Harvey? Be the second
Love
nominee.
Tanzania too.
Okay. So we have two nominations, and so I'll let the candidates speak to their nominations.
Yes, so I would love to sort of be in a leadership position here with the Board of Health. My background is in public health. I'm very passionate about being here. I'm still very excited about being here. And so to be honest with you, with the way our board is structured currently, there's still a lot of, we've come a really long way and I'm feeling really on stable ground. But there's still some things that are just unsure, right? So I wasn't sure if anybody else would be interested, and I definitely, if not now, am really trying to move towards something of that nature. So that's my spiel.
Yeah, and I guess obviously would be totally happy if you were in that role. I just want to offer, just in case you think strategically at this time, politically, it would be advantageous to have someone with medical expertise or experience doing kind of high-level leadership positions. I would think I have that. I've been the president of the Washington chapter of the AAP. I've done legislative work with the Foundation of the Washington Vaccine Association. I'm on the board of Seattle Children's Care Network, Best Start Washington, and I feel like I'm a little worried we may have a more active public coming up. And if you think that that would be helpful, obviously I'll be here anyway. But if you think that that would be a helpful skill, I would be happy to help.
I would like to rescind my nomination, and I would like to nominate myself for vice chair.
Okay, so now that that's been rescinded, we have Dr. Harvey for chair. All those in favor, say aye.
Aye.
Okay, congratulations.
Thank you.
Okay, and so now the baton is yours.
Oh, all right. So I guess I took over for the nominations for vice chair, and we have Tanzania. Are there any other interested?
I'd like to nominate Commissioner Mejia.
All right.
A second. Yeah.
And are there any further nominations? All right. Would you like to add to your spiel?
I would. It's changed. So,
All right.
I mean, essentially the reasons what I just named, right? I'm really here to serve. That is the biggest reason why I show up here and volunteer my time, and I'm working with you all and really creating a body of work. I want to serve our community, and I want to do that in a way that is meaningful and impactful. And I do think being vice chair is going to sort of put me in a position where one day I could be chair. And I feel like I have a lot of leadership skills and a lot of really assertive strengths, but there's a lot of like facilitation and just certain growth edges just based on experience, right? And I would love to be in that next position to be able to learn to get there. So, and just being honest, I think Commissioner Mejia has so much going on that she may not necessarily have the time, so.
Thank you for being mindful of my schedule. I'm sure my aide really appreciates that.
Commissioner Mejia.
Yeah, I decided to run for vice chair again because I am so excited that community members were interested in that chair position. But as we're heading into that role, I think just having a little bit of that county perspective as the vice chair, because there are situations that occur where community members are put a little bit in, sometimes in an uncomfortable situation. It happened last year. And just sometimes having that county perspective is also very important to help kind of guide on things that we might be able to do, or sometimes things that really bleed onto the Board of County Commissioner role. And so having kind of that separation and being able to give that advice to the chair, I think is very important. Another reason why I wanted to run again for this position is because there are several things I would like to accomplish for this year as vice chair, and there are several things that I would like to continue working on with public health on this role, and just kind of seeing it and I'm not interested in the future in running again for vice chair or for a chair role. You know, in my previous years as a Board of Health member, I never really had that opportunity for a leadership role, and that's why I stood up last year as the vice chair, and I kind of want to do 2 years just to kind of phase out my role. So, yeah, that's it. That's my speech.
All right. So how shall we vote on this? Should we just do one at a time and count, or any suggestions?
Just do the vote?
All right.
I'm sorry.
Yeah, do we just do one at a time and count it? Or?
Yeah, we can do.
All right. All of those in favor for Tanzania?
Aye.
And all of those in favor of Commissioner Mejia?
Aye.
Aye.
All right. So we have a vice chair with Commissioner Mejia, and we have a wonderful in-training leader that we will, I'm sure, use your skills on a lot of the committee work and with helping drive the things you're seeing that could be better. So maybe we'll do like a mentor relationship.
I think that's really important. And to be honest with you, I'm so glad that you said that. I think, and I was at an event last night that sort of inspired this sort of conversation as well. I think it's really important that if you are currently in any elected position and you are a leader, to really be, and this is something that I feel like is really lacking in Thurston County, I don't know what it is. I love that elected officials are so available. Like, I could really sit down and have a coffee with somebody. I could really dig in. But it feels like that more structured, more formalized style of mentorship is just not really there. And so if I am wanting to be chair of this board one day, there is going to be at some point a knowledge dump that people have to have. You're gonna have to let go of whatever projects, whatever you have going on, and actually give time to set somebody else up for success so that they can also lead and do something for the community in the same vein that you are trying to do. So I would love more mentorship in this position, in this space with this group. Thank you.
Gotcha. All right, do we have anything else?
An executive session, Chair, and there is, action items.
All right.
I think we have to share.
Oh, all right, so, anything that, any of the members would like to share or call out as far as things that you're seeing or thinking we should be thinking about?
I do. I have one. So most of you know I'm a part of the Leadership Thurston program, and on Government Day, I was able to hear the mayor of Lacey talk in detail about, specifically in the city of Lacey, how they are addressing trafficking through the massage parlors that are popping up everywhere. This was a big problem in the 90s, and we happened to have a chief of police at that time who was had a task force and was very dedicated to addressing it. And obviously, it's been a long time since the 90s, and there's been a change and shift. So he essentially laid out the framework for how they address that, and we would, as a city here, have to get the chief of police involved. So that's obviously way down the line, but I know people have seen these here, and I mean, they are popping up everywhere. I have done a little bit of citizen investigation, and I have gone into several and taken notes, and it absolutely looks as if there may be signs of trafficking happening in these spots. So as the Board of Health, we're in Human Trafficking Awareness Month. We just have the data right here as to why this is important and all the reasons why we should be taking this on in some form. So if a neighbor city has just recently created framework for us to follow and try to implement that here, I think it's important to look into that.
I was gonna say, like, maybe we can ask staff to follow up with the city of Lacey to share that framework with us and send it to us via email, and maybe this is a conversation in the future that we can possibly have and expand on it, right, and see what.
Has Olympia taken that up?
Yeah, Commissioner Fournier?
I was gonna say, would that be something that would be we can invite the sheriff to come in and speak about his efforts on that and kind of his knowledge and where they're at regionally?
They were invited tonight and couldn't attend, unfortunately. So yes, we could absolutely.
Okay.
Yes.
I mean, Ty was asking if Olympia's involved, and we actually had we convened our general government committee to just have a report on the complicated and tedious work that Chelsea was describing, to document it to the level that you can create charges. But we do have people who are going into each of those businesses to keep an eye on what's going on.
And it's people, you mean law enforcement, correct?
Mostly, I suppose. Yeah.
Okay.
Yeah.
Any other people I'm missing? Right, and then I guess I would also like to say if there are things that you want to do differently with how we run our meetings or different like set topics you want to have on the agenda, I think let me know, and I'm very open to hearing that. I like to run a pretty tight meeting. I like everybody to read stuff beforehand so that you actually can get to substance. And certainly let us know if that's not working. And then I'll definitely try to help be involved a little bit ahead of time in agenda setting. So if there are topics that you want to make sure we get on, just let us know. Yeah, Commissioner Miga.
I do have an item. So I attended an immigration coalition this past Saturday. Councilmember Gilman was there as well. And one of the concerns I think that we should be aware of, or, you know, especially because we've declared racial equity as a public health crisis. And one of the things that was alarming to me was that federally sanctuary places that were previously considered, such as churches, hospitals, schools, are being removed from, and so those spaces are not going to be able to be safe anymore for a lot of members in our community. And so as we continue to have conversations, I think that's something that we just need to have present, that there are going to be a lot of federal law changes that are going to impact a lot of our community members in every aspect. So just wanted to kind of highlight that piece of changes coming in the future.
Commissioner Menzer.
Could I ask, it might be a question for Director, our subcommittees were paused and there were staffing issues, and I'm just wondering kind of, since we have a new board member, kind of what's the, what does that look like for 2025 in terms of subcommittees, reconvening, et cetera?
Dates have been set up so they can get started back. Our Board of Health Clerk, Jeffrey Gilly, will return on February 18. And Melanie Bruno, our executive aide, will still stay involved and help that transition after that period of time. So subcommittees will start back up. I have discussed the various committees with board member Gilman and also Commissioner Grant has chosen the data subcommittee. So we have added there. So we will make sure that we get everybody on the right committees and have those starting back up.
Okay, great.
Does anyone else want to do the policy one as well? There's 3 of us right now. They're hanging strong.
With big things for policy.
Big things.
I'm in.
Yeah.
Yeah.
You just recruited right there.
I know. I'm like, come on. There were some subcommittees where everyone wanted to be in, and then the policy, I was glad that Tanzania decided to join us on that one because it was just me and Ty just hanging out.
Oh, all right. We'll get you added.
Awesome.
And those dates are all
Glad I
set
brought
for the
that
end of
topic
this
up.
month.
Yeah, because I think we can see that we're finally starting to get some movement and some ability to give input and support. So I think that's great. All right. Anything else before we are hitting the end that I'm forgetting?
We have an executive session,
Oh,
which I'll just ask these two who will be leaving, and then we'll do that. And we'll get you out of here. Thank you.
Let me pass you the RCW for executive session. So we'll just announce that you're for how much time,
Is there any
Jen?
sexier ones?
5 minutes.
I think it's the best.
5,
Yeah,
10
right.
minutes.
So we are officially going into executive session, RCW 42.30.110, G, to evaluate the qualifications of an applicant for public employment or to review the performance of a public employee, and this will take about 5 minutes.
We still have one person online. I'm unsure.
Yes. Commissioner Rainfornier is still coming. Oh, I see.
No, there's another attendee that I'm not sure.
Yes, it.
Amigo Marquez?
All right, so we are officially coming out of executive session at 5:28. And we'll close this meeting unless there are other action items.
Motion to adjourn.
All right.
Don't need one if you're at the end of it.
Oh, okay, great.
Official, if you just come to the normal end of the approved agenda.
Okay, great.
You can just adjourn.
All right, we can adjourn.